today we have a very special guest. This is a world-renowned osteopath whose work has touched people's bodies and lives in ways most of us have never knew possible, and I am definitely one of them. She's one of the few practitioners on the planet specializing in urogenital and visceral osteopathy. And this isn't your typical massage or manipulation. This is a deep, internal, unprecedented work healing the bodies of people who've survived, like myself, cancer surgeries, pelvic trauma, sexual violence, chronic pain, scarring, and deep nervous system patterns we often carry in silence, and I was one of those people. She also trains practitioners around the globe, teaching advanced visceral and urogenital techniques, challenging the medical and manual therapy establishment, and building a new generation of body workers who are willing to step into places most people fear to go. Get ready for a raw, honest, unfiltered conversation about stigma, resilience, anatomy, trauma, touch, and how the body remembers and heals. Welcome, Natalie Lejeune. Thank you so much for joining me.
Hello, Melina. How are you? Thank you.
I'm great. Now, Natalie, you're joining me from Bali.
Yeah.
One of my favorite places, like my second home. I met you probably, I'm going to say easily 10 years ago was the first time that I actually came across you. And I personally was in a lot of pain, and my sciatic was playing up, and I want to give people an idea of how we actually met. And I spoke to a friend of mine, and I said, oh my God, I need an osteopath. And he said, go to this lady, trust me. And so I ring you up, I get an appointment, I could barely walk at this time. And I remember walking into your property at the time, which was up in Ubud, or near Ubud, and you took one look at me and you went, you're wearing a tampon, go take it out. And I was like, how did you know? Like, how is it written on my face? How did you know? And I was like, okay. And but as I'm doing it, I'm thinking, I'm having an osteo appointment. Why do I need to take it out? And it was something I wasn't expecting. And quite frankly, I've seen you multiple times over the years. I've seen you after I've had vaginal surgeries, because I've had cervical cancer twice and I've had numerous surgeries. And you freaking changed my life. So this is one of the reasons why, because you are so unique with what you do, I wanted to bring you on and get people to understand what you do. So explain to me in plain language, what is urogenital osteopathy and how's it different from traditional osteopathy? Tell everyone what you do.
Osteopathy is a manual medicine. It is a medicine. It's not only techniques. It's a medicine because we do diagnosis. We do osteopathic diagnosis. So there is a long controversy with the physician doctors, okay, because they are the only one allowed to have diagnosis. But no, in osteopathy, we are allowed and we have to do diagnosis. Okay, that's why when I saw you walking in, I could say that there was a problem with your pelvis, okay, and there was something that was not fitting exactly. That's why I asked you if you have a tampon, okay, and you say yes, okay. Sometimes I have women coming complaining for shoulder, that I don't ask if they have a tampon, but I ask if they have an IUD, for instance, because an IUD, yes, can give some problem with shoulders. Okay.
Oh,
So
okay. All right.
in osteo, maybe not all the osteo, but osteopathy normally we go beyond what we know. We go beyond what we see. Okay. It's really learning to read the body, to read everything that can be read in a body. Okay. So there is no secret places or forbidden places or whatever. everything can be treated with respect, with understanding, and I would say with love, because love is a very good ingredient. You have to put love in your treatment. And love is not empathy, compassion, la la la. It's not new age thing. It's really you must love the structures you are healing. I'm not speaking on personal love, appreciating or not the person. You can dislike the person, but you can still give treatment with love, because it's beyond yourself. It's about the cells. It's a meeting that is beyond yourself and the patient. That's very important. So to go back to osteopathy, um, human beings need to understand and to frame everything. So you have people specialize in visceral, in pelvis, in spine, in craniosacral, but all of this is the same, okay? Because they're applying osteo, what medicine is doing, cutting in pieces the body. The body is one unit. The body is functioning. You have a problem. You have, for instance, you sprain an ankle. You can have problem with your bladder a few years after just because of this sprained ankle that hasn't been healed on time. Because that's what happened. It has an impact. Lower limb problems have an impact on the pelvis. And conversely, problem with the pelvis can give problem to the lower limb.
Wow. Okay. So, all right,
Everything,
everything is interconnected, is what you're
it's
saying. Like,
all
I went
connected.
in for one thing and it turned
Yes,
out to be like, I went in going, oh, I can't work. My back is out. I need an adjustment. My
so
sciatic is
you
playing
have
up. I
to
can barely
understand
walk.
why. Why is the back? So it's not, I'm not speaking about psychological or transgenerational levels, okay? We stay just with the body, okay? Just stay grounded here, okay? So when someone has a back issue, first, is it a man or is it a woman? Because it won't be the same diagnosis. Let's say it's women, because now I mainly 90%, 99% of my patients are only women, because I'm more and more specialized by the women themselves. I've never choose one day to say, okay, today I'm going to specialize in women health or men health. No, it's because since I've been graduated, people were asking me, pushing the boundaries. So
Mm.
I took a lot of postgrad, and I still do, because I'm passionate about what I'm doing. So I still learning. I'm still
I
learning.
found that you definitely seem to specialize in the reproductive organs, and that's for both men and women, because you've treated myself, you've treated
Yes,
a male friend of mine also,
yeah.
who had testicular cancer.
Urogenital system. It's the urogenital system. It's not so much reproductive. It's urogenital system. The content of the pelvis. Okay. For men, the main thing to be treated, the one who's going to give big problem is prostate.
Yes,
Okay. So doing treatment for the prostate is one thing for men. Okay. To prevent surgery, to prevent vascular issue that can give varicocele, for instance, kind of issues like this. Okay. And after that, after surgery, you have a lot of things to do as well. Okay. So there are specific treatments for men. But again, pelvis is not working itself. Pelvis is at the very end of the body where the gravity is the worst. Because before that, you need to go back to the thorax to start with. Thorax, it's negative pressure. And if we don't have the negative pressure installed in the rib cage, then all the other organs, starting with the liver, that is the biggest one and the heaviest one in the body, are not going to stay with the attraction of the thorax, of this negative pressure. So everything is moving down. And the very last one is the bladder. And the bladder is suffering from this gravity and from this disorganization in this attraction. Okay? So that's why you need to investigate for someone who has a problem with the bladder issue, someone who has prolapse, someone who has congestion, pelvic congestion, giving PMS, for instance, premenstrual syndrome. All of these, you need to go back to thorax, to the spine, but thorax is not to crack. It's to understand how the ribs are working. Are they free? Are they not free? Okay. And while you're there, you can check also the fight and flight system, the autonomic system, you know, the nervous autonomic system. You can check it because it's right behind the head of the rib. It helps also to calm down people, to help them to settle down, to enjoy the session, and to have a better reception of the treatment as well. Okay. And it takes no time. You won't spend 1 hour on that. Okay.
Yeah.
So,
Yeah.
and after that, you need to have a look on the visceral area, because the pelvis, the health of the pelvis depends of the visceral cavity, and mainly 3 organs. I'll make it quick with 3 organs: the kidneys, the position of the kidneys, the position of the small intestine, and the liver. All of these for vascular system reason. We're not going to, it's really plumbing, so we're not going into that today. But pretending, and I wait my words, pretending to doing pelvic work and to have results without checking these 3 key organs, it's fake.
Forget
I'm sorry.
it.
Because
Okay.
most part of the time, when you have done your treatment, checking the pressure in the chest, reestablishing a good vascularization position, freeing the different ligaments, the different organs into the pelvic cavity in the belly, if you prefer. Okay?
Yeah.
Your pelvis is already better.
Isn't that interesting? I remember, like, I went in there, and my first experience was I was getting adjusted from the inside out. So you were doing internal fascia work. It was the memory of the body. So as you were, all my organs were in the wrong place. That definitely came up. It was like, no, all your organs are sitting correctly in that way. I mean, that's saying it very broadly, but
But that's gravity. And
okay, the gravity
surgery.
and surgeries,
And
like I'd had
surgery. Of
surgeries.
course. Of course.
Mm. And then it was also, I remember I started crying. And I remember you in my ear going, let it out, let it out. And
Exactly.
there was trauma. There was trauma that had come from sexual trauma. I haven't had babies, so women may have birth trauma, but there was sexual trauma, there was surgery trauma. There was this trauma that was, it felt like it was trapped in the body. And I didn't realize this. Like, it was such a unique experience for me. And, what you were doing would be classified as taboo. Okay. The way that the manipulation was done, and it was, maybe taboo in the industry. And I will say, I've spoken to some people, and like, I know people that work within, say, the adult industry, and they're doing, Yoni massages and stuff like that. This was nothing like that. So what you're saying before, where you've got these, professional or so-called professionals that are out there doing certain kind of, work, whether it's internal trauma work or sexuality work and stuff like that, they're not connecting what they're doing because they're not properly trained. They're like doing half the job. They're not doing the whole job. They don't fully understand how everything is connected. Is that how you'd put it?
Well, it depends what you want to do. I'm not going to judge the others' work. They work as they want. But I mean, if you really want to have result, and normally people coming to see me, that's what they're looking for. because they're a little bit pissed off not to have a result, in fact. Okay? So it's always no, but I can say 2 women on 3 coming to see me are sitting in front of me and saying, listen, it's been 20 years, I've been looking for someone that can really resolve my problem. I don't know if you are these one, but you don't have time to lose. You have a 1-hour session. Doesn't mean you're going to change the world in 1 hour, but you can improve a lot of things. And you can, it's a conversation with the body. What the people are telling me, I'm very polite, I'm listening to a certain point, but it's not interesting because the brain never forget that one part of the treatment, and that's what I do at the end of it mostly, but sometimes we start with that. It's the brain. I'm not speaking about craniosacral thing. I'm speaking about working on the brain. That's quite different. And that's what Jean-Pierre Barral have been doing for now more than 45 years. Okay, he's my master. He's the one I'm following all over the world for training. The last training I did with him were about the brain, and I've been running around the planet to catch the different training, because it's very important to understand that that's where everything is stored. Okay, and when you have, for instance, problem like sexual abuse, what's going to happen? The brain is going to disconnect from the body. That's explain why the people first freeze, are not able to help themselves fight against the predator, okay? Because they freeze, the brain freeze, literally, okay? Yeah. And the problem is, it stayed freeze. It's not. And you have a big disconnection between the body. So the part where the trauma happened is totally disconnected from the brain. So the body is still functioning, no problem. The body is still functioning, but the memory is not there anymore. And that's why sometimes, not so much when I'm working, but people come to see me when they have this awakening. But doing some yoga session or some body work in a way or another, or going through a situation that all of a sudden it's, pop out the lid and the brain says, we've been there already, or what's it? It's exactly like this. And then the person is, what happened? Okay? Yeah. And there the journey starts. And I am on the way of the journey. I'm there. I'm not the first one, not the last one. I'm part of it. Okay? Yeah. And that's why it's very important, because these people, they may have waited for 30, 40 years sometime to have this awakening, to have this reconnection with themselves, to get back their life. Okay? So you're not going to play around with that. You have to be adamant.
It's very unique and very special work. How long have you been doing this kind of work for?
Let's say I've always been in that. I just wrote a book, How I Became an Osteopath, by the way. Everything in my life put me on that direction. Certainly because of my mother. My mother was someone very spatial, very unsettled person, very unsettled, very nervous, very. She had trauma that at the time, as a child, I couldn't know. My birth was already a trauma, and I think that to save my mom, to make it short, to save my mom, I had no other option that to work in the field of genomes. That's all.
Okay.
Just to put it like this, okay?
Okay.
So after, why osteopathy? Because after the birth of my child, who've been extremely traumatic, I met with one of my cousins. We were coming back from the state where she graduated with Viola Friedman, who was at the time the goddess of craniosacral and children treatments in osteopathy. So it was 42 years ago. And when she saw my son, she said, "Oh my God, the head!" So it was, what? Yeah, two manipulation with forceps. My son was a little bit bad.
Okay.
Like this, okay?
Yeah.
And so I didn't know anything about osteopathy. I was just a nurse at this time. And I went for a session with her. And when I saw her treating my son, I said, that's exactly what I want to do. And it took me 7 more years to realize my dream. And believe me, it's been a journey because I said, I will be an osteo. I want to be an osteo. And you get out of the way because I will be an osteo. And I have been an osteo. Yeah.
I love it. Determined, determination. Look, the
Yeah.
thing is, I really found that, yeah, you get to it and you want to change lives. You want to
It's not
help
my will.
people.
I'm just answering the call of the body I have in front of me. Because, no, wait. You have people, and that's what I explain in my book. You have people making appointment, but they don't want you to change anything.
Wow. Okay.
Yes. So don't get me wrong. That's why you have to read the body you have. And if you have people doing only Yoni massage or thing like this, because it is convenient for these people going there knowing that there will be no reconnection to the brain.
Oh, wow. Okay.
Because
Interesting.
the big factor, the big changing factor is pain. 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 If you
Yeah.
don't suffer enough, you don't want to change anything.
Yeah. Oh, wow. Yeah. Well, I have had a yoni massage once from a female, once from a male. I can honestly say I felt I have the one I had from the male was it was actually in Bali, and a young, very young girlfriend had referred this masseuse, and this was the outcome. And I'm like, whoa, hang on a minute. I actually messaged her afterwards going, did you know, like, did you walk into this massage knowing this was going to happen? And I didn't. And, it wasn't like, I just heard he was a good masseur, right? I was shocked because I went, hang on a minute. I felt if I hadn't done a lot of personal work on myself, I would have felt quite violated, to be honest, and not being able to surrender into the experience and the orgasm. I've really found that there is not enough permission being asked, traumatized. Once you're sexually traumatized, then it is visceral. It's the whole body, it's the whole nervous system,
No,
it's the
but
fascia, it's everything.
when you have, sorry to interrupt, but when
No,
you
go for it.
have trauma, you're just like a goldfish in a bowl. That's how your brain is. Okay, so that's why at some point someone has to put his hand, in the bowl and take the fish out.
Yeah.
Okay,
Yeah.
look, we're going to do other way. But again, and that's the main thing. People, not everybody wants to be treated. Not everybody wants to change the pattern. Not everybody wants to remember. Okay? That's very important because it takes a lot, okay, to accept what has happened to us already. And it's the same, for the people, for instance, when a child has been raped, incest, for instance, daddy coming in the room at the evening, for the 5 years, 8 girls, little girl, the little princess, okay, and mummy,
Yeah.
Okay? So telling the truth at some point means also pointing mommy,
You
okay? The
ignored her. Yeah.
behavior of mommy. So it means that you have to be free from your family tangled, you know, to be able to do that.
Yeah.
That's that's where you need to understand. When I have people say, because I always ask, of course, as it's again, I don't start with internal manipulation. And
Yeah.
when I think that it would be good to do internal manipulation, I explain. And as I've explained during the consultation what I was doing,
Yeah.
I explained that at this point of the consultation, I would suggest vaginal treatment or rectal treatment, depending on the reason, and I explain why. And the person is free to accept or to
Yeah.
refuse. If they are refusing, I accept it, of course. And I said, okay, we're going to try something else, and that's all. So some people feel the need to justify. No, you don't have to justify. Okay? The day you will feel ready, you will come back. It
Yeah.
doesn't mean the session is over. It's not that.
Yeah. It is a journey. You're right. You are definitely part of that journey, that, healing journey. For me, it was a healing journey.
Yeah. But
Yeah,
you
very
cannot
much so.
impose, you cannot impose to people, "Oh, I'm gonna heal you."
You
No.
have to do it. Yeah,
And
exactly.
many people, I have women coming to see me. That's why I'm asking questions before giving an appointment.
Yeah.
Why do you want to come to see me?
I do remember you asking that question. Yes. Why?
Yeah,
Yes.
why me? Okay,
What do
you
you
have
want to get from it?
various osteopaths around the island to start with. Why do you want to come to see me specifically? Because it's a kind of a pact. If you want to see this therapist, you know that it's this therapist is going to be the tool, because that's not, we're nothing
Yeah.
else. We are
Yes.
tools. Okay,
Yes.
I'm not dispatching healings like this. I am a tool the patient will use or not use.
100%. And then when I've spoken to other people about my experience, and when they've gone, oh my God, they were ready. And that is the fundamental difference. They were like, I'm ready to get this show on the road. I'm ready for this journey. I am ready to let go of something.
You know, that's the mental. When you start to talk to yourself, it's sorry to say, but it's bullshit. It's the good excuse. All right?
Yeah, go
The
for it.
deep, the deep acceptance, the deep approval is in the cells. And
Yes.
that's where I know where someone is ready or not. It's not what she's going to say, because
Oh, you've
that's
called me out. I think it was my last appointment with you. You turned around, you're like, you're using your mind, and you're like, "Oh, I'm talking to the body." And I loved it. Like, for
exactly.
me, I
I
loved
like
that. I'm
to
like,
let you
oh,
talk, but I'm speaking with the body. The exchange is with the body. What's the body saying? And when the body is saying, I remember one patient I had a long time ago. I was just beginning. I was in France at this time. She came because of the pressure of her superior and a few colleagues of the office where she was working.
mm-hmm.
She was reluctant to come. She didn't want me to touch her. Every time I was putting a finger on her, it was just like electric shock. I had to move out my finger. So at some point, I try every possible entries: feet, head, jaws, chest, belly, of course, organs, visceral. It was not possible. So I told her, I say, but why did you come?
Well, you hear, yeah.
Why are you here? You don't want me. And it's not a judgment. It's just, it's fact. You don't want me to touch you, me or someone else. I don't know. But
Mm,
you look like you don't want any treatment. So why did you come? Why did you do that to yourself? And that's what she said. She said, because I didn't have so much the choice. They say I have to change and I have to come to see you. I Good for them, but maybe not good for you.
Yeah.
And we
Maybe
stopped
not
the
ready.
session after 10 minutes because, and she was woo, relieved, Okay, thank you, goodbye.
Okay. So that's good because some
Yeah,
practitioners would just, it's still like they would just keep going. And it's like, well, hang
no,
on, you're wasting time. You're
no,
maybe causing bigger issue and more trauma if that's the case. Interesting. So with your industry, um, I mean, a lot of doctors and therapists and other osteopaths, they're actually very wary of the internal fascia work. Now we're talking about a bit of that. What's the misconception? Like,
because you don't know how it works. That's all. When you are
okay,
worried of something, it's because you don't know it.
okay,
Okay?
yeah, all right,
It's only that. And because they have the, oh my God, I'm not going to do this, and this pressure, and this, I don't know, because they think that it's all about, how can you say that? It's not right, it's sexual, and that.
yes. A lot
No,
of people
sorry,
connected to sexual.
I'm sorry, pelvis is not only sexual. Pelvis
Yay!
is
Say it
anus
louder.
and it's bladder. Okay, it's not only sexual. You have
Yeah,
three and not entries, but way out. Okay, you have urethra, so it's all about bladder, but also the kidneys and the
yeah,
ureters. Okay,
yeah, yeah.
okay. In the middle, you have the vagina and the uterus, but it's also your period. It's
Mm,
also birth, okay? And you have the rectum, and rectum is linked to your intestine. So
yes.
somewhere it goes to your mouth, okay? That's the digestive tract. So that's why you need to understand the different function. And when you start to, oh my God, how am I going to behave and that kind of things, leave it, because you're not at ease. So of course the patient is not at ease either.
Yeah.
If you're not comfortable with what you are doing, how can the patient be comfortable? Because the patient can perceive that a shift in your attitude. So of course they worry. But when
Yeah.
you are clear and you say, okay, listen to me, I'm going to explain you. And you've been explaining already what you were doing, okay? And you say, now, this, because you have a problem, let's say, with your bladder, okay? You have UTI, chronic UTI, okay? So there are different things with the UTI. Okay, I worked on your kidneys. I already improved, for instance, your ureter, because the left ureter was a little bit loose because the kidney was a little bit low. So this is already back to normal. Your ureter is stretched, so the peristaltism inside is better. So everything goes one way down directly to your bladder. But now we have this short pipe named urethra. You had a traumatic birth. The head of the baby was squeezed and stuck in the pelvis and was pulling on it. And someone has the bright idea to catheter your urethra because
Mhm.
you couldn't pee. Okay,
Mhm.
just in
Mhm.
case they did the catheter, so they bruised it, they damaged it. Okay, your
Okay.
urethra is still talking about it at the moment. So that's why I cannot work on it if I do not go through your vagina, because of course you don't go in the urethra. So I have to go through the vagina, meaning from here.
Yeah. Show us your little. Yes. Perfect.
Okay,
Okay.
so
Yep.
that's the main entree, sorry to say. Okay, and so here it's very thick, but in fact it's not. So you can work on the urethra, and you can feel that the urethra is bulging,
Mhm.
swelling, congested. So it makes like an accordion. So you have a lot of corners, you have a lot of places where it's a folds, where micro drops of urine can stay stuck.
Mhm.
Okay,
Mhm.
and they create not even infection because you don't have fever, but you have a good inflammation, okay? Chronic inflammation, okay? So if we work on your urethra and we just stretch it, okay? And we open this fold and unwind it just by working with the pads of the finger. You're not until here, we're not done, okay? Thank
I think
you.
it's what people think.
Okay?
Your hands,
Yeah,
the whole
yeah.
arms up there.
People think, oh my God, she must be to the elbow. No, darling, no. Just the pad of my finger. Relax, relax. Okay. So you put it here and you work on it. Okay. And here, what do we have? We have the symphysis. Okay.
Yes.
We have the pubic.
Yes, that's that. Actually, hold it up a little higher. That's actually the
Exactly.
where you were working on me and explaining that what was triggered.
Right.
Yeah, yeah.
We're just here, okay? So when you work on this with your other hand, you go at the back of it, right behind, so you can control your bladder because in fact you're here, okay? So after doing that, you can work on the bladder and it's the same. The bladder is just a pouch. So you
Mm,
work with two hands to unfold and help the bladder to unwind. Everything
okay,
goes back,
interesting.
okay? If the tissue are not stuck, they know their job. We don't know
Mm,
better than the body we are treating. That's also is extremely important to remember. We don't know better. That's why we cannot impose a treatment.
yeah.
Okay?
Okay.
We
Yeah.
help, we guide, we suggest, the body takes or don't.
Yes. Yes.
Right?
Yes.
But the
So,
integration can take time. Some people have immediate integration with a lot of breathing and loud breathing. So
mhm,
it's not to show off, absolutely not.
yeah.
Okay,
Yeah.
it's
Yeah.
just reaction. Okay,
Yes.
some are crying, some are laughing like crazy.
Yeah. Okay. Interesting.
Autonomic nervous reaction. It's meaning that's sympathetic and orthosympathetic systems.
Because they're all
People,
interlinked and they're all
that's
intertwined.
all.
Yeah.
Don't look for emotional release, la 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 la. It's
Yeah.
only physical. And then when all of this is back to on track, then you can do your brainstorm on this.
Yeah. Okay. Yes. I love it. Yeah. Because I remember I'm like, what is this water coming out of my face? It's like there's tears. And I remember you touched me in a particular spot, and it was actually, I think it was on my coccyx bone. And I'd totally forgotten that I'd had, I mean, how in God's name I forgot about it. That, I'd had a hemorrhoid operation. And it slipped my
But
mind.
the
But it
body
was like just
cannot
boom.
remember.
Yeah,
The body,
my body
you
remembered
know,
for me.
the funniest thing I have, it was one of the a patient. It was in France also. It was a man that I was treating, and he was I don't know what he came for, but at some point I was treating one of his leg, and the fingers, because the tissue are attracting when you have a restriction of mobility somewhere. Your hands are naturally attracted to it. Okay, that's why you listen to the tissue. You listen, and this we listen. Okay, we don't
Okay.
know better again. So I was working on it, and I said, "Wow, I don't know what happened to your leg. Did you break it at some point? No, never. No, 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 no." And all of a sudden, this man in his 45, 50s something, stopped to cry and he was sobbing like a child. I remember, I was on the swing and my cousin pushed me and I fell off the swing. Okay,
Wow.
so you keep your mouth
Boom.
closed and you say, what's wrong with him? And then he composed himself and he said, yeah, I was 8 years old. I forget about that. But she pushed me, the bitch. And the leg was fine after that. You see, memory of cells. So the
Yeah.
problem was not the leg. The problem was this cousin, this dear cousin of his that he was surely in love with, She betrayed him in the point, you know. She just pushed him in the back and he fell.
Wow. Okay.
That's
And
what it
it's
was
amazing. Like from
from.
how far back? The
Exactly.
memory, yeah,
Yeah,
the
it
body
was
remembers.
45, 50, something like this. And he's such a
Wow.
cry as if he was, I think it was 8, he said. Yeah, something like this. Yeah.
It's funny because sometimes we use the words, the problem's there with the problem. So we think it's this, but it's actually that. And
That's why,
that's perfect.
when people start to justify why they are here, and I assume it's about this, and I assume that this, and for me, say, okay, just we can just ask the body, okay, I understand you have that and that and that as a problem. Let's check the body and see what the body is saying about it. Okay, where is the blockage? Where did it start?
Yeah,
Okay,
exactly.
and the
I have a
answer is not here.
question.
The answer not in the mind, I mean in the
It's
brain,
in the body.
but it's in the body. So that's why people can talk during the consultation. I don't mind, but I don't pay attention. I'm paying attention to what the body is telling me.
Yeah, I've seen you do that. I see you just drop into this zone and you're feeling everything and sensing everything.
I close
It's
my eyes because
you do.
I see better.
I remember you doing. I remember you actually putting your hands on my head and you close your eyes and I was
Yeah,
sort
of
of looking
course,
up and
because you want to see what you're doing, so you close your eyes.
yeah, and I was like, she's zoning, man. I love it.
Oh,
She's in her zone, and it was
no, oh, yeah.
fabulous. But what was amazing was you were like, the blood flow is different from the left to the right side. And you asked me, do you get migraines in your right eye? And I'm like, what? Because it was true. Everything was just spot on. Boom, 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 boom.
When you
So,
listen to the body, you have the answers, okay? That's
yeah,
it. But you must study to understand how the body works, okay? How
yeah,
physiology and anatomy are working. And then only when you master that, you can start to discuss, talk, ask the body.
yeah. I have a question. So I know that you teach what you do, and there's not enough of you. Okay, I want to clone you, I want to replicate you, all that, because the conversations that I have with women had it's childbirth, chronic UTIs, constant UTIs, problems that have happened because of IEDs, cervical cancer, or rape, all these different situations that have happened to their bodies. And, what you're doing is very unique in the journey that somebody, whether it's a male or a female, their healing process. So when I know that you teach this, so what's the perfect practitioner? Because I'm assuming the perfect person to learn what you do and to go through your courses would be someone who maybe is already a practitioner or not. What's the right kind of person? Because we need more of you. We need more people to
Okay.
learn this.
For reason of ethics, I prefer to teach to people who have some medical background for ethics. Okay, I teach body workers, and depends of the country also, because every countries have different laws about are you allowed to do this or that, or
Yeah.
not. For
Yeah.
internal work, it's always challenging because it's always about doctors and about physio and midwives. They are mostly all around the world the only one that are normally allowed to do internal work, okay, for medical
Okay.
reasons. And honestly, it's true because, for instance, when you take a man uh, doing rectal manipulation on someone with hypertrophy of the prostate can be dangerous. So if you don't know what is a prostate, how it works, how it is normally, and what to do when you do a rectal treatment, you are a dangerous person, because
Okay.
what can happen, you can create a spasm on the sphincter of the bladder, because prostate is all around the sphincter of the bladder. because the urethra in man is going through the penis, okay? But when it goes first, it's going through the prostate when it goes out from the bladder, okay?
Yeah.
So it can be dangerous at some point if the prostate is really hypertrophic, okay? You can create a spasm. And it means that the bladder cannot empty. So it's an emergency. It's a medical emergency. So that's why you need to have people knowing about that. Okay?
Okay.
The same for women, according to the cycle, you cannot work at some time of the cycle. It's not recommended to do internal work when you are very close from the period. And D1 and D2, the day where your uterus is going to bleed a lot, you don't touch it. You leave it alone. It's a sacred time, okay? But D3, when you have no bleeding or very, very little bleeding, it's starting to be one of the best time because the hormonal level is very, very low. So it means that the ligament system of the pelvis is going to react and to take what you are going to do. Because it's all about ligaments. You don't move the uterus or you don't move the bladder or the ovaries. It's not working like this. You work on the ligamentary system of the pelvis because you have many ligaments holding and pulling, you know, on the different organs of the pelvis, and for all organs, in fact, okay? And that's where the intelligence is. You deal with structure who can answer to your treatment because they have neurotransmitters, because they have nerves, so they are connected to the brain. And that's how the correction is recorded and understood. Okay? It's not to work on the organ, it's to work on the ligament. So that's why it has to be precise. So that's why the audience, for the when I teach, they have to know what is uterosacral, where they are attached, where do they end, what is the pathway, what are they crossing, which artery, which nerve are they crossing or not crossing, okay, that kind of things. For the ovaries also, you have coming from the uterus, you have the tube here, but the tube is not alone. You also have ligament and arteries, okay, and vein. So you have, when you work on the ovary, is not to twist the ovary and to touch it, it's to work on this ligament. So it requires to know where are normally the ovaries, where is this ligament starting, how you can connect it, okay? So when you do internal work, where you have to put your fingers.
Yeah. How much practical work is suggested before people, like, let's say I work in the medical field, or I'm already an osteopath or a body worker?
Before doing urogenital work, normally, and it's not only me, everybody teaching urogenital, because I'm not the only one to teach urogenital. Normally, you need to complete everything in osteopathy and specifically in visceral before to understand already what are ligaments, the ligaments holding the viscera, okay?
Yeah.
How to work on them, and the vascularization, because of course vascularization is crossing all the body. Everything is linked.
Yeah.
Okay?
Yeah.
So that's why you need to have a good knowledge in anatomy. It's very important.
Yeah. Okay.
And physiology, to understand how it works. And for instance, if you're pulling too much on the ligament, you're going to stretch it. It's not what you want. You want to relax it. So instead of stretching, you're going to compress your ligament to give him the time, what we call the breathing, the respiratory pose. So you compress the ligament, then the ligament will expand by itself. You don't constrain, you help. Okay?
So for someone, let's just say my osteopath goes, I'd like to extend my knowledge and, I want to do this sort of work. What's the window of time? I suppose everyone might learn differently, but, what would be reasonable?
It depends. I created the online courses for people who cannot go for teaching easily, okay? Because not
Okay.
everybody can go somewhere for different reasons, okay?
Yeah.
Cannot leave for 3 days because normally trainings are usually 3 days of training, okay?
Okay.
Where you have the teaching and the practice and everything. Those who can't, who wants to work and to pick up, just pick what they want, for instance.
Yeah.
We have
Yeah.
the online course. So there is the module 1, what is the fundamental, the basics in urogenital. Everything you have to know and to do before starting a more precise treatment in urogenital, meaning before doing internal work, okay? Before
Yeah.
touching a uterus, before touching a bladder, what
Yeah.
you should have done and understood before. The second course and the third one are, the second is female pelvis. So all the different structures and their treatment. So it's the treatments of the ligaments. It's not treatment of pathology. It's
Yeah.
treatments of the ligaments. And then
Yeah.
when you know how to treat, how to talk with the different structure, you can treat any other disease related to these structures. Okay?
Okay.
And the third one is about the male pelvis. Same. You review anatomy, physiology, okay, in my courses. I have this review because it's handy for people to have everything on the same line. If they want more information, they can have their books with them. But I did a written course, and every structure, every manipulation is recorded on a video. So people just watch the video, and the video are made in a way where they see exactly where to put their finger, and I explain what I am doing. Okay, so, and with the video they can review and review and review as much as they need. Okay.
Yeah. Yeah.
So that's why sometimes I think the online courses are much better because you can review. You have courses where you cannot record what the teacher is telling. Okay.
Yeah. Yeah.
You cannot record the manipulation, and it's extremely frustrating because you pay for that. Sorry.
Yeah. Yeah.
And when you have 25 techniques taught in 3 days, only 10% of what you have been taught will stay. When I do the training, but I have to say at the moment, this moment, the world is not helping for people to travel around and to take, trying to see if in September you can come or not. So I've suspended everything. I'm good willing to travel to people's place, If you organize a course, 20 people in the room, I can come. It's easier for me to travel alone than for you to travel from all over the world. So that's what I've been doing mostly all the time, okay? And then I teach specific things. For instance, a treatment, postpartum treatment. So postpartum treatment is not only about the uterus. It's about how was the birth? What kind of birth was it? Because you're not doing the same thing, and you're not going to test the same way the body if it was a C-section, if it was breech, if it was natural birth, if it was the first one, if it was the third or fourth baby, okay? It's different. And it's not only about the the uterus and the urogenital system. The brain
The mind.
is really
Yeah.
important because these women, in postpartum, they lost their brain because of the hormones. And you have to explain them what they've been through. And those who had C-section, that's what I wrote in my book. I speak. I have a chapter for that. The different trauma, the babies crying all the time. Also, treating the babies is very important. So postpartum is not only the woman; it's also the baby.
Baby.
You have to treat the baby
Mm,
Part of it. It's
exactly.
part of the postpartum. Sorry to remind it, but it's true.
Yeah.
Yeah? It's not only the uterus.
I'm sitting there thinking, like if more practitioners actually went into this and learn how to do this, I really feel that,
You cannot force people to learn. That's the biggest.
oh, that is true. I'm more thinking of
More patients.
women, women knowing there's options,
Yeah,
I mean, because unfortunately a lot of women don't, women and men. I want that to be last resort, not first resort. Now listen to my body more than I ever have and become more connected. And I just sit there and go, wow, if this opportunity was out there, there was more people doing what you do and, spreading the love and giving people opportunity to connect in with their body. Can you imagine the healing that would happen? It would be amazing.
yeah, but that's the patient to tell to their therapist, I would like you to upgrade a little bit.
Yeah.
If you don't tell
Yes.
the therapist, they think they are perfect.
Yeah. I
And
think a lot of therapists don't even understand what's
they
possible.
they think that what they are doing is all right.
Yeah, the
So,
medical establishment is very tunnel visioned,
yeah, and
unfortunately.
they've been told that there are things you cannot do because la 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 la. You don't know why, in fact, but it's all about this. So if someone can change something, it's the patient.
Yeah,
The patient,
it is.
if she's satisfied from my treatment, she can go back to her usual practitioner and say, listen, guy, that would be
Yeah,
great if you do a training, because when you do this and that and it was not functioning and I didn't have any shift and I was still feeling the same, and with 1 hour treatment she changed things in my body and I can see the difference. Me, I cannot do anything,
yeah.
it's not in my hands. The only thing I do and I can do is to treat people. But after, if the patient is not relaying the information, that's all, you know?
That's all. Yeah, yeah,
And we are in a society where people find themselves, they are very satisfied by themselves. They are very satisfied by what they do. They don't want to improve because they already think they are at the highest level. What can you do? Okay.
So I want to sort of finish up the last bit. So we've just talked about, our practitioners telling them, uh, step up their game and expand their knowledge and help us out a little bit more. I want to go back to the customer or the clients, that patients that you're all looking after. Patient. Okay. So I want to just ask a couple of quick fire questions here. Let's just say you've got a woman and she's saying that she's having pain during sex. Is it fixable?
Depends of what, but mainly it's around the fornix of the uterus. So it's a part of the uterus it's around here, right there.
Okay. Yep.
Okay? That's the fornix. So here you have the cervix.
Yep.
So pain at this time, it's triggered by the ballistic of the penis. Okay, it means that the penis is uh, shooting right on the cervix. So the
Right.
ligamentary system is taking the vibration, and the vibrations are irradiating all in all the pelvis. Okay, and this is deep dyspareunia, what we call deep dyspareunia. Okay,
Okay.
it's not only this problem, but it's one explanation. Okay, and this
Yeah.
we can treat. But when you have cervical surgery, for instance, that
Yeah.
can trigger
Yeah.
dyspareunia. Okay,
That's what I had. Yeah.
yeah, after cancer, you have, because you have a restriction of mobility of this tissue, and you have a shortening also of the vagina. Okay,
Yeah.
same after hysterectomy, when they remove the uterus and sometime with the cervix. Okay, so the vagina, the roof of the vagina, instead of being high, is low. Okay, so it can be dramatic because the penis cannot penetrate. Okay,
Yeah. Yeah.
Another reason for dyspareunia is the ligament. You have ligaments that have been damaged, stretched beyond their capacity, for instance, during birth. Okay.
Mm-hmm.
So some fibers of the ligaments have been really injured, damaged, and they cannot restore. So it's just like a big elastic, and so all the ligaments are paired. Okay.
Yeah.
One ligament, for instance, is hanging loose. So the uterus is tilted. So depending of the ligament, it will be tilted like this or tilted like this. Depends of the ligament. Sacrouterine ligament, or if it's just the broad ligament or the round ligament. So depends. Okay, but we can do a diagnosis according to how the uterus is tilted. Okay, so when these ligaments are damaged like this, when you have the ballistic of the penis on this on the cervix and moving the uterus, the way they have fibrosis can bring pain also. So this can be surgical, not always.
Okay.
You try to see if you can restore the elasticity by specific manipulation, induction techniques where you are following the fibers of the ligament, of the tissue, okay, and you are compressing the ligament to give them space, and then just like a large breathing, depends, you adapt, okay, but anyhow you never stretch on it. That's the rule. Okay. If it's restoring, that's good. If
Yeah.
it's not, it's surgical. That's all.
Okay. Yeah. What about oh my God, not the contraceptive pill. Oh, I learned that one the hard way. What about IUDs? Recommend or not recommend?
No, but you cannot be like that. It's not to recommend. It depends. Women, at some time of our life, we need absolutely to have contraception.
Yep.
That's how you must take the problem. It's not
Okay.
this is better than this. It's not that.
Yep.
Okay. What kind of contraception can you have? According to your age, according to your hormonal system, according to your if you have been pregnant before or not, etc., etc. Okay,
Yeah.
according of your way of life, according of are you married? Do you have regular intercourses or not? Okay,
Yeah.
condom is a contraception. Okay,
Yes.
also. Okay, so IUD, yes. What kind of IUD? So you have some women have the copper one. You still have copper. It's hard to find, but you still have the copper one. But the copper
Okay.
one, the why are they using copper? Because copper create inflammation. So when you put a copper IUD in the uterus, you're going to create a slight inflammation of the endometrium, the internal mucosa of the uterus. So when it's
Okay.
inflamed, if ever you have fertilization, because it doesn't stop the fertilization, right? You have ovulation, you have intercourse, the spermatose was able to go through your tube, you have
Yep.
fertilization, and then 10 days after, it's coming back to plug on the mucosa. And that's why it's not comfortable, it's not welcoming, because it's so inflamed, so the egg cannot plug. Bloop. So
Okay.
you have late period, you're
Yep.
late maybe 10 days, 8 days, and you bleed like a pig. And you have contraction.
Well, I was put on the contraceptive pill at 16 because my periods were like Niagara Falls. Very uncomfortable.
So one thing with the pill, yeah, you can take the pill. The pill is chemistry, okay,
Mm,
and it impacts your libido. Women with the
mm,
pill, at some point, they complain they don't have any more libido, and it's normal because
okay.
the dosage are always the same when you take the
Yes.
contraception, okay?
Yeah.
So when yours are not the same, they are varying according to the stimulation you have, Okay,
Yeah.
so
Yeah.
that's why you have a big difference. So many women are complaining that in fact they take the pill, but they don't feel like making love anymore. And the second thing
Interesting.
with the
Okay.
pill is a part of all the problem it's creating. Okay, yeah, you can have stroke. People just seems
Yeah.
not to remember that. But I remember
Mm,
when I was a nurse, meaning 40 years ago, I had a young woman of 25, mother of three, because at this time we're having kids very early. She was in ICU because she had a stroke, because her pill was overdosed for her.
right. Yeah. You got to get the dosage right. I had to go through a few
Okay,
before I found out that
so
worked. Yeah.
it's also one of the big factors. And another thing, because nobody knows that, in fact, only some osteos specialized in urogenital know it. Pill has an impact on the organ, just like you had a cover of silicone on the organ. Means that the organs are going to lose their ability to expand. So
Okay.
one organ is going to suffer of it. It's the uterus
Okay.
during pregnancy. And you have these women, you can see immediately because that's the question asked. You took the pill at some point in your life? Yes, why? Because your uterus is not expanding, your uterus is pointing forward below the navel. You know, the,
Yeah.
the pregnant woman with the belly protruding below the navel, you have the navel moving forward like this. When the uterus, with the round ligament of the uterus, these ligaments, okay, they should verticalize. And the baby and the uterus is moving
Yeah.
up, not forward, up.
Yeah,
And the
wow.
baby is along the spine of the mom. So there is
Hmm.
no discomfort,
Okay.
okay? But those with this belly moving forward and not trespassing the navel, it's because they had the pill a long time. But even
Wow.
so the good news is you can work on the uterus during the pregnancy. It's a
That's
specific work to help the uterus to expand. And it's absolutely fascinating. You see these women coming with a very low uterus and they go and they leave.
wow. Okay. Now that's a whole nother level. Wow. I never thought of it that way.
Yeah, yeah, you can work on it. That's what I teach. So it's not in the online course, it's
Okay.
specific teaching in
Yeah.
the
Yeah.
pregnancy and yeah, you can work on that. It's
Ah,
the muscle. So you don't work on the uterus, you work only on the myometer, the muscle of the uterus. And
okay.
that's
Okay.
absolutely
So back to the IUD. Endometriosis is a it,
this Mirena thing, and now Kylina. That's the one with the hormones. Okay, this
Kalina.
one for endometriosis. Yeah, that's the second generation and third generation in IUD.
Yeah.
They stop your period because they are diffusing a little bit of progesterone. So
Yes.
for your brain, for your hormonal system, is as if you were pregnant or at the very beginning of a pregnancy.
Yeah.
Okay, so you don't have your period.
So how would that help with endometriosis
You
though?
have, because the problem with endometriosis is the building of this endometrium, so the
Yeah.
internal mucosa of the uterus that is migrating out of the body. Okay, so
Okay.
it's invading the vagina, it's invading the rectum, but you have found some, of course, in the visceral cavity on the different organs, for instance, intestine, but it has been found also in the lungs and in the brain.
Okay.
But the problem is this mucosa is highly responding to hormones, of course. And it means that after, at the time of ovulation and after ovulation, when it's building up with the progesterone, it's growing and it's full of blood. and it's
Okay.
pushing around. Okay, so that's how it creates pain, and that's how these women are full of pain, because it's a kind of mass, okay, that are stuck in the different
Okay.
places. So that's why you have surgeon dedicated to that. You have a French guy, Horace, I don't remember his name, but he's teaching and he's doing a lot of surgery because it's a very specific surgery. Okay.
Okay.
And
Yeah.
this, at some point, you cannot skip the surgery. It's better. Otherwise, the solution. So back in the days, they were giving contraception, a pill that was stopping ovulation. So if you don't have ovulation, it means that you don't have progesterone, so you will not have your period. So your
Okay.
endometrium is not going to grow because the endometrium, as the mucosa of the uterus, is the nest building
Okay.
every time you had ovulation. It's preparing in case of fertilization. And
Well,
it's building from D14 if you have your ovulation on D14 up to D28 normally, when if you didn't have any fertilization, then the nest is destroyed and you have your period. So you
okay.
win. Okay. So this mucosa is also migrating out of the body. That's normal. And that's why also in the ancient time, women with a period were supposed to stay put. So much endometriosis since, I'm sorry to say, okay? I'm very sportive myself, at least I was. But you don't do any gym, you don't play football, you don't run cross-side of the wood. When you have your period, girls, you don't do that.
Do nothing. I used to
It's
actually,
not
I was
saying
bedridden.
I'm not saying that you have to go to bed, but I remind you that the tribes, the tribes, you had a special hut for the women when they were having their period. They were sent to the hut, and they were very happy because during 7 days they were doing nothing.
Yeah. Oh, I remember a naturopath I
And
saw. I was probably 15, 16, and she was telling me about the American Indian tribes. And when the women cycled,
exactly,
obviously they all cycled together, they would get
it
removed.
was
They
heaven,
would,
darling. It was
and
heaven.
they would,
They were
yeah,
in between themselves. They were doing nothing. They were
yes,
resting. They were
yes,
eating. They were taking care of themselves.
yes,
Okay?
yes,
It's a good
yes,
deserved thing. The same,
yes.
I remind women that postpartum is more or less 42 days. So it means you don't go back to the gym the day after giving birth.
These are the hints and tips and
That's
tricks that
why I'm
people don't
treating
know.
women, because we are not men. And most of the gymnastic program, or the gyms and everything, the weightlifting, are designed by men. We are not competing. We are out of that now, please. Okay, a woman is a woman, and her needs are not the same as the body. Just the same, for the drug companies. The drug companies, when they are testing meds, they give mostly to men because they have more men coming, and they decide that it was good for everybody. It's not. Aspirin is not working the same in men than in women. It doesn't have the same effect, just to say. Okay, so that's why women, we have different physiology, and we have to understand that. So you play tennis, you play football, you play rugby, whatever you want, but you don't do it when you are on the age to have your period. You respect your organs. That's all. Because after
Oh,
that, you don't come to complain 10 years after you have problem.
so, oh God, this is the
Take
stuff
your
they need to teach back in school.
responsibilities. Okay? Take your responsibilities.
Yeah, yeah. I'm with you. In the last probably 5 years, yeah, it was the first time in my life where when I was menstruating, I just nurtured myself. and the difference was massive. It was also the first time I'd cycled regularly. I'd gotten off the contraceptive pill after 36 years, and I was really connecting to my body, and I was really respecting it and nurturing it and
Now,
connecting
you
with my
don't eat the
feminine.
same. You don't eat the same when you are before your period, when you are after your period up to ovulation. Okay, at this time after your period, after D3, so you don't need to stay confined for 7 days because you have your period, but at least the 3 first days are the most important. Okay, specifically the 2 first ones where you have the most of the bleedings, because that's where the mucosa is migrating out of your body and can be stay and fixed everywhere in your vagina and even migrating through your visceral cavity. So that's why that's the period you need absolutely to, you do your usual stuff. You can walk, you can work, you can, but you don't go to the gym. You don't exert yourself. Okay. You don't do
Yeah.
45 kilometers with your bike. No, you don't. Okay. And yeah, that's it. Okay.
Oh, we need to nurture, 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 nurture,
Okay?
nurture,
Yeah, you
nurture.
have your normal life. You can have your normal life.
Yeah,
Okay. You,
yeah,
yeah. Just if you want to go for a small walk, you go for a walk. Okay. But you don't accept your body. You don't want it out. You take care and nurture your body. It's your best ally. When your body is not working with you, you suffer, you're in pain, and that's how you seek help. But sometimes it's too late because you discuss
yes,
too much. Okay, and we're not a car that you can go to the garage to fix and you change the pieces. Okay, you can change some pieces, but not all of them.
all of them.
Okay?
Yeah,
And it
yeah,
needs a surgery, and surgery, huh, they are good, they save a lot of things, but the problem with surgery, they have a very bad side effects named scar tissue. And scar tissue,
yeah.
uh, just
Oh,
like
yeah,
iceberg, you can see the 10th up. Oh, you have a scar here. Yeah, but you don't know where the 90s are dispatching the body, and they can be very far, very far.
yeah. I've learned that the painful way. Yes, definitely. It changed my physical, my emotional, my spiritual eventually. And I got to a stage, sexually it was yeah, those scars were quite painful, and yeah, it was interesting to see how my body reacted. So I'm glad I've been on the journey to connect in with my body more, listen to my body more. The last time I was diagnosed with cervical cancer, and the doctor's like, oh, we need to go in and do this now. And I went, I'm going to go off. I'm going to talk to my body. I'll get back to you. And then I went off and I did, I did listen to my body. And 10 months later, I went back to him and we did all these tests. And he's like, what did you do? I said, well, I didn't listen to you. I tried alternate methods. And he said, your results are amazing. I did have a surgery because the first surgery 20 years ago had caused issues. So we were trying to remove that. I found, the results were amazing. Now I'm trusting, listening to that body. So I want to say to you personally, thank you very much for, you know, being part of my journey, because it did
That's a
fundamentally
part of
change my
it.
life. Yes.
That's exactly, part of it.
Yeah.
Eh? I'm a tool, and that's all therapists, that's all we are. We are tools. We shouldn't forget that, okay? We are not life changing, knowing better than you. You use the tool and you do your life changing. It's not us,
Yeah.
it's the
Yeah.
patient. That's why I insist on that. Not everybody is ready. Eh? That's why I gave some example about that.
Yeah, that's true. That's true. So thank you. Thank you very much for joining me on this podcast. Thank you so much. And how do people find out more about you and your courses?
Okay, I'm going to give you the link for the website because
Okay.
it's the best way. Okay, and they can contact me through the website without any problem.
Fabulous. Thank you
Thank you
so much
very
for
much.
joining us.
Thank you
And
very much.
until our next episode, everybody, bye from us. Bye.
Bye bye.